Hi, my name is Kristen. I am an MSW student in the ASAP program at Ohio State. My current placement is here at Talbot Hall Addiction Medicine through OSU Medical Center. I was asked by OWEP to talk a little bit about addiction. And so the bare bones of addiction is basically it is a primary chronic disease that we also tend to refer to as substance use disorder in this field. And so there's a lot that goes into this, but essentially the basics of addiction is that the substance, whatever it is, whether it's alcohol, benzos, opioids, whatever it is, when the substance is used, it affects the reward center of the brain and it releases dopamine. And so as the substance use persists with the individual, the brain gets used to having this external source of dopamine provided all the time. And so as time goes on with the chronicity of this disease, as time goes on, the brain really struggles to make dopamine on its own. And that's kind of where addiction comes into play, where, now we're needing this substance just to feel normal, essentially. And so there are three stages in the cycle of addiction. The first is the reward center we talked about. And then second is that craving that comes with the chronic use. And the third stage in this cycle is ultimately the withdrawal. And so this is what happens when you don't have the substance. You don't have access to it. And in my current field placement, I am in the inpatient detox center here at Ohio State. And, here we treat very, very sick people. Withdrawal can look like a number of things for people, typically with those that struggle with alcoholism, alcohol use. These are people who may even have seizures. And these are people who require medical supervision just to detox. Because it's unsafe to do so without that medical support by doctors and nurses. With opioid withdrawal, it's a little bit different. You're not going to see as many seizures are possible. They're not quite as common as just the overall, stomach cramps, nausea, vomiting, no appetite, dehydration, and just kind of all around feeling awful. And these symptoms kind of come about when, the substance is, when the body doesn't have the amount of substance that it is used to having, then these withdrawal symptoms happen, and they can kind of come on at different times for different people. Some people may be able to make it a couple hours before it comes on. Some may be able to make it a couple days. It just really depends on the individual. But the withdrawal aspect of it is a very harsh reality of the substance, because, this is something that can very well kill people. And so that's why units like Talbot exist, is to help people with the withdrawal management. There's a lot that goes into addiction, and there's so many moving pieces to it. And again, it really depends on the individual. There are environmental and societal factors that really contribute. If somebody is living in a home where their roommate or their boyfriend or their parents use, this is somebody that, is probably going to end up using themselves, or they're going to have a harder time really abstaining from the substance and maintaining sobriety. And this is where relapse is very common, because a lot of people do have others directly in their home that are using, or they have friends, and everybody in their lives are kind of involved with substance use or drug trafficking. And so that environmental part of it is huge. If the substance is always available, and just with peer pressure and things like that, it can be pretty difficult for somebody to stay away from it if they have someone in their lives that are very close to them who are encouraging the substance use. And then in addition, just some of the societal factors that people face. I think when I think addiction, I really think stigma. So the stigma that we're talking about is, you know, typically people who are struggling with addiction have a pretty negative view of themselves because of how everybody else looks at them. This is a population that even within the hospital system, that stigma is very alive and well. My unit, we recently had an issue where we had to move our patients to another wing of the hospital just due to the rising COVID numbers. And we noticed there was a significant difference, and it shouldn't be like this, but it was. There was a significant difference in the quality of nursing staff. So when these patients are treated by nurses who are not detox nurses, there's definitely a lot of stigma that's faced, you know, even within the medical system. You know, addiction is looked at as a shameful moral failing, but it's not, because it's a disease. And I really think that, you know, as substance use professionals, we really need to work to educate everybody around us, whether in the professional or the personal setting, on what addiction is and how it's really affecting people. You know, to me, also as a first responder, I look at addiction as, you know, this is when I have a patient who's overdosed, I look at this is somebody's sister or mother. This is, you know, somebody's child. This is a person. And I think with addiction, we really need to understand how, you know, there's still a human being underneath all of that. And yeah, that's about all I got for you guys. Thanks for coming to my TED Talk.